I had a patient who told me, हमको दिखता नहीं है, हमको बोला तुम्हारे दिमाग में प्रॉब्लम है. So I had to explain to him कि आपको जैसे हाथ पैर में सूजन होता है वैसे आपके दिमाग में थोड़ा सा सूजन है और आपका टेस्ट दिखा रहा है, तो ये सूजन को भी ट्रीटमेंट देना पड़ेगा और आंखों का भी ट्रीटमेंट देना पड़ेगा. So that patient is with us and he's been to us almost like 18 times and his treatment is still going on. So we have 2-3 cases of neuritis. It's a tough call, but if we stop the treatment, he'll probably go back to worse. So this is an ongoing treatment. These are difficult cases where you have to handhold. And he's been sitting on the footpath selling newspapers because if he moves around, he could fall. His vision is very low. He has a 19-year-old daughter who's studying and the wife is domestic helper, washes utensils and runs the house. So from where are they going to get medicine for the inflammation in brain? I used to head the Asia's largest processing center in Mumbai, where they used to process corneas. And even though that institution was a charitable trust, there were gaps in the system which I noticed. So a patient below the poverty line had nowhere to go, despite the fact that they would get probably a cornea free or at a subsidized cost. But there were other costs involved, there were other expenses for which we decided that let's try and help out these patients below the poverty line. So that is what the original idea was. It's a very simple mission that we are on, that there are patients below the poverty line, way below the poverty line, who don't even know that they have visual impairment. So we are trying to ensure that their vision is restored so that they can go back to their routine chores. That is one thing. And the other thing is we are trying to have presence in places where there is very little eye care. Because it makes no sense having this alternate model in places like Hyderabad or Chennai or Madurai, where there are giants and there is already a lot of scope there. There are giant hospitals with outreach programs. So we'd rather be in places where there is very little eye care and set up our alternate sight restoration model. A simple thing like cataract is not something that the villagers know. They do not know that their vision can be restored. We are present in 3 states at the moment: Maharashtra, Bihar, Madhya Pradesh. So in Maharashtra, we are in Mumbai, Navi Mumbai and Pune. In Bihar, we are in Motihari, Arari and Aurangabad. Aurangabad is a place in Bihar. And we are presently in Gwalior. And hopefully we will be in Bhopal because it's the same partner NGO. We are a referral model. We do not go out to patients directly. So the patient is usually referred by somebody known to us, either an individual or a hospital or a doctor. We work as facilitators. And we have no clinic, no hospital, nothing at all. But what we do is we connect the dots. Many a times the patients are so poor, they haven't heard of a PAN card. So whatever documents they have, we need to screen, we need to do our due diligence. And if the patient fits into the criteria, the first criteria is orange ration card, which is completely free. And if the patient is really struggling, we will provide you with transport and a snack. Then comes the yellow ration card, where we will partially support you, we will guide you, we will handhold you, but full support may be difficult. The next step is assessment. Now this is where our alternate sight restoration model kicks in. That if you are a resident of South Bombay, you do not travel to the suburbs like Kalyan or Dombivli to get your groceries. So why would a patient travel all the way for treatment? That is the whole concept of the sight restoration model. So a South Bombay patient, anywhere, the Cuff Parade slums, okay, or slums near the Sassoon Dock, that side. So they would they would find it easier going to a surgeon or a hospital which is closer to South Bombay. Roughly around 50 to 60 different intervention centers across 7 locations, out of which the top 10 or 15 are the ones that give you value for money. And again, I would say that it's not that every institution or every intervention center does everything. So we have kind of identified which institution does what kind of level of expertise they have, and what kind of honesty they have, what are their value systems, what kind of ethics do they follow. Because sorry to say, there's a lot of mis-selling that happens in the medical field. And these patients are so poor, there is no room for mis-selling. You cannot operate unnecessarily, or you cannot give unnecessary treatment because they are as it is washed out. The assessment is an eye-opener for a lot of patients. That becomes the discovery stage, because that's when the tests start. So that is when sometimes a patient discovers that they have urinary tract infection, or they have blood pressure, or they have diabetes or something. हमको पता ही नहीं था. They've never tested. It's only when their vision was blurred and they found it very difficult to do their daily chores that they decided to go to somebody from a referral partner. They have come to us. So we need to support every patient on a different level. If you look at the entire profile of 7 locations, we see that 60% are cataracts. But the profile changes per location. If you look at only Bombay, then it's just 40% of cataracts. The rest are entirely comorbidities. Like patients who have HIV positivity, or there was a patient who was treated for infectious hepatitis. We have patients of neuritis, uveitis, encephalitis, the list goes on. It's a long laundry list. So anybody with complications, usually the ticket size goes up. Now we have patients referred to us by the Rotary group, and all, without exception, they are either paraplegics or quadriplegics. So as a result, we need clearances from the neurologists, from the pediatric ophthalmologists, from the anesthetists, and there's a long list of tests which need to be done, because we do not know how these patients will react to the intervention. Let it be a surgery, let it be a simple thing, but whatever it is, we need to be sure. It's a case-to-case kind of work that we do, and that has been our forte for 20 years. It's a very simple, light model which doesn't require infrastructure, buildings, equipments, this and that. Whatever is there, utilize that. And to give you an example of Gwalior. So Gwalior, we partner with a large NGO which works with elder care. So they take care of 60 plus, all those who are 60 plus, and it's a holistic care. Everything from healthcare to rehab to everything, including ration and even the tiffin service. So now all these, they cover 108 villages in Gwalior, in and around Gwalior, and they have one location called Bhitarwal. So they have a center over there. So we have a surgeon who goes there and checks these patients, and those who need intervention, they are brought to the city itself. They are operated and they are sent back. They have a vehicle, it's a very large organization, and then the surgeon goes there for follow-up. So the model is a workable model. Those are the models we try to work, and it's very different in different places. The same institution works in Pune, and there is a eye hospital which does camps only for these elderlies. It works with the NGOs. And we support, say, 10 cataracts a month. Now we are trying to support 30 or 40, which is the actual toll.